Today we're covering off a bit of a meaty topic. Covering off is probably a loose word. We're going to touch on it.
We're going to tip of the iceberg, yeah.
And we're talking today about anxiety. For those of you who don't have anxiety, what is anxiety?
So anxiety, I mean, we use the term a lot nowadays, don't we? But it really refers to a worry or nervousness, usually a constant thing that's not necessarily realistic or related to the situation around you. It can often be accompanied by physical symptoms like heart palpitations, tight chest, muscle tension, and at its very extreme can lead to more chronic anxiety disorders and panic attacks as well, which is that real sense of dread, feeling like you're going to die. You usually really have those physical symptoms of sweating and heart palpitations and tight chest to go along with that. But many people are experiencing this at a lower level as well, so it's a really common presentation, I think, for both of us in the
absolutely.
clinic.
I think it's important to note that we're not talking about feeling scared about something, because that's quite a rational thing. Being scared of falling if you're at a height, that's an important thing to keep you safe.
That's a safe thing.
That's a very real thing to be afraid of. And we're not talking about being slightly anxious some of the time either. This is an all of the time an irrational response of our bodies, something which is a bit more systemic.
Yeah, that's right. And it's a really huge issue at the moment. So currently in Australia, anxiety is the leading cause of disease burden in people under the age of 40. So it's very rife, and I'm sure many of you listening, are quite familiar, either experience it yourself or at least know someone who's experiencing it.
Mm-hmm. There's a book which I was reading recently called Can You Die of a Broken Heart? I can't remember the author's name, but I'll pop it in the notes below. And in that book, the author, who's a cardiothoracic surgeon, was talking about how there's particularly women are often just dismissed as having anxiety when it could actually be something else, and particularly when it's a life-threatening presentation to the hospital. A male is more likely to be sent off for further investigation of cardiothoracic concern, and a woman is more likely just to be dismissed as having anxiety when really it's something of concern.
Definitely,
So,
yeah.
Even in the medical world, there is it's not just a confusion about what anxiety is, but it can often mimic other things.
That's true, yeah. And I think it's that that thing as well of, it's become so common that often people assume that it's normal for them to feel that way, where there's a real difference between something that's common and something that's normal. So supporting people through that, because it's actually a really horrible thing to experience on a regular basis, and it can really interfere with people's lives and how they live their lives as well. So
yeah, absolutely.
we really want to be able to support people to be able to manage it in a way that is helps them live more freely and be free of some of that distress.
It's certainly something that if you do have some of those symptoms, to really get in contact with your GP and have a good heart-to-heart conversation with them, and certainly ask for a referral to someone who has got some mental health training and specialty. And for not everyone, talk therapies don't always go the way they need to. It's not this type of therapy which is helpful to all persons. We're all individuals, and sometimes we need to delve a bit deeper.
I think anxiety and mental health in general is an area that kind of gets put in its own little box and pushed out to the side, but it's actually really important to take a holistic approach. So definitely important to talk to your GP, definitely important to seek advice or some psychological help with a counsellor or psychologist. But there are also other modalities and things that can help, because there are also physiological drivers and causes that contribute to anxiety as well. So would you like me to go into that now?
I guess first of all, Kelli, you are a clinical nutritionist and a naturopath.
I am.
Yeah. What are some of the ways that people can take, some people who have anxiety are able to support themselves, and just as some general advice?
Yeah, sure. So to start with, nutrition is really, really important to our mental health, and when we are trying to improve anxiety, manage anxiety, it becomes really crucial. Not as a standalone treatment, but as a supportive therapy. And part of the reasoning is because of some of those physiological drivers and causes. So we know that inflammation, particularly inflammation within the brain, it can be a real driver of anxiety, and there's a strong association there in the research now. And our diet contributes heavily to how much inflammation is in our body. So to start with, we need to make sure that what we're putting in our body helps contribute to an anti-inflammatory response and not a pro-inflammatory response. I think secondly, when we are talking about our brain chemistry and some of those neurotransmitter pathways, they are heavily nutrient dependent. They are formed from the proteins that we eat. So the amino acids from those proteins form the foundational building blocks for those chemicals. And then they require numerous vitamins and minerals to actually produce those chemicals and to activate them in the brain. So even just with those two things alone, nutrition becomes really, really important. And then we talk about the gut as well, and gut health and the gut-brain axis. And we're finding out more and more how important that is. That might even be a topic for another live. But looking after our gut health and our microbiome is going to be really crucial to what's happening in our brain.
It may sound a bit strange that our gut impacts heavily on our brain and the way that we feel, but the research is showing that our gut is really the fourth of the known brains of our body now. The two brains inside of our head, left and right side, our spinal cord, and then the gut, and it's production of hormones and transmitters which do impact heavily on the way that we feel, the way that we sleep, and our thought processes.
And even if you just look at serotonin alone, so 95% of our serotonin is made in our gut, and heavily influenced by our bacteria that live in our intestines. So you know, you can imagine that if you've got suboptimal gut health, if there's inflammation in the gut or alterations in the microbiome, that your ability to produce some of those chemicals is going to be impaired. Actually, they've found up to 30 neurotransmitters are produced by bacteria in the gut.
I didn't know that.
I didn't know that. I didn't even know there were 30 neurotransmitters. But serotonin's a big one, and GABA, which is heavily implicated in anxiety, is produced in the gut as well.
So I often see with the people who are presenting with anxiety to my workspace that they're often taking a whole bunch of nutritional supplements, often self-prescribed, in the hope of feeling better than they are. What are some common things that someone could actually safely go and purchase, maybe off the shelf?
Yeah.
And when should they actually come to see someone for support?
Yeah, sure. So I think before you even start talking about supplements, it's important to really get some of those foundational things right. So making sure that you're doing some of that dietary stuff, like eating an anti-inflammatory diet, drinking enough water, because even mild dehydration, so some studies have reported that even being 1% dehydrated, which is really quite mild before you even start feeling thirsty, actually can contribute to those feelings of anxiety and panic. So doing some of those simple things and some of those lifestyle things to start with is really important. And by lifestyle things, I mean, you know, getting sunshine and doing some gentle movement, and doing some deep breathing or meditation or whatever works for you. And then when we go into nutrients, so there is a number of different nutrients that can really help with anxiety, depending on the presentation and what the key drivers are. But things like, so fish oil is one, and turmeric actually, because they're both anti-inflammatory, and so they help manage some of that neuroinflammation or that inflammation within the brain. And then there are some probiotics which can impact mental health and behaviour as well. So we refer to the probiotics that influence mood and behaviour as psychobiotics. So there are specific strains that do this, so it's important to have the right strain. But these are things that are generally quite safe. And then there are various nutrients. So if you have a nutrient deficiency of magnesium, vitamin D, B12, all of these can contribute to anxiety, even some of your other B vitamins as well. So I heavily discourage people to self-prescribe because it's really important to have a thorough health assessment to know.
Expensive.
A thorough health, well, it's upfront, it's more expensive, but if you go, honestly, people come into the clinic and they've spent thousands and thousands
That's exactly
of
what I
dollars
mean.
self-prescribing things that were probably doing nothing or just weren't quite the right dose or the right fit or the right quality for what they needed. So it's important to weigh that up as well. And also there's the safety aspect. Like, yes, these things are generally fairly safe and safer than pharmaceuticals, but that's not always the case, especially if you're on medications or you've got underlying conditions. So getting advice becomes really important if you want to actually get good results and do it safely.
It's important to take away that just because something is natural or plant-based doesn't make it safe, and that plants are the original medicine, and all medicine should be treated with respect.
And many of our pharmaceuticals came from plants originally, isolated from plants. Yeah. Yes. So, and herbal medicines, actually, this is a great area where herbal medicines really shine as well, because we have some medicines that help regulate the nervous system. So particularly if anxiety is a result of long-term stress or a specific trauma where it's created that dysfunction in the way our body responds to stress. So there are some herbs that are particularly good for that. And there are some that act in a similar way to pharmaceuticals as well by supporting specific neurotransmitter pathways. So, and certainly herbal medicines even more so get some advice if you're taking medication, because we want to do it safely. But I love using herbs, things like, I think you mentioned before we started about withania or ashwagandha. Rhodiola is another one I love to use. Passion flower. My mind's going blank now. Kava is another one. So there's quite a number that we have to choose from, depending on what that individual needs and responds to well.
And with all these things, dose is really important. Yeah,
dose is important, absolutely. Yeah, you need the therapeutic dose, and you need a dose that's not too high either.
Absolutely. Some of these things just make for expensive urine if not used properly.
Yeah, that's right. And of course the lifestyle stuff as well, really important. And I think massage is one of those things that people can add in as well to really support the management plan. Yeah,
absolutely. And we do see a lot of people who've come in for a massage to help with their management of anxiety. And I think it's important to realise that massage isn't going to fix your anxiety. We're talking about something which is systemic, and certainly a one-off treatment is not going to be the silver bullet for you. But it does form part of that essential management plan, and is, apart from just something which is really nice that you can do for yourself, and certainly pick your massage wisely. If you're going to a place which is very brightly lit and it's a massage therapist who likes to pound you into a pulp, probably your anxiety will be worse off from that experience, unless that's something that you really enjoy and maybe it's a distraction. But often a massage for a person who has anxiety, the room will be dimly lit, soft music playing, so we're talking about a de-stimulating environment. a softly spoken therapist who treats you compassionately and understands you, who will listen to what you want in your massage and doesn't just go on treating parts of the body which you haven't given permission for. So you discuss those things up front. These are all part of helping you to feel safe and supported in the environment. And then our skin, which is the largest organ of our body, so repetitive strokes across the skin has this destimulating effect of turning down the volume of our parasympathetic nervous system, one of 11 systems in the body. The parasympathetic nervous system is the rest and digest state of our body. When we are resting well, then we feel better, and things like serotonin production increases in that time. And the touch of another human against your skin stimulates the production of oxytocin, which is associated with trust and feeling supported and safe and secure. And so these are just some of the small benefits that a massage can have if you do live with anxiety.
Absolutely. And I think before we started, you referred to a massage like turning down the volume of the nervous system. And I really love that imagery, because that's pretty much what you're doing. You're kind of giving your nervous system that break to help it regulate. And that can just help bring down that anxiety, and those triggers become a little bit less triggering, which is a really important part of that as well.
The caveat, of course, is if you don't like the thought of another person touching you, then massage probably isn't going to help you.
The good news is that we've discussed lots of different things you can do in very general, quick overview, but hopefully there's something in there that you can do or that you think might relate to you and help with your anxiety.
If you do have any questions, maybe pop them in the comments below. If you don't want to have a public question, then get in contact with Kelli or myself. We'll put our contact details again in the notes below. We'd love to speak with you. And if you are living with anxiety, don't do it alone.
Awesome. What he said.
Yeah. We'll catch you in another episode.
Excellent. Bye.